I wanted to talk a little bit about the elephant in the room, but at the same time, I really wanted to use that as a stepping point to discuss the risks of acetaminophen because it is a over-the-counter medication that I frequently recommend to patients and something that a lot of patients have access to and use on a regular basis. Hello and welcome back. I am Adam Rosen. And for those of you that haven't watched before, I am a board certified orthopedic surgeon. I've been in practice for over 20 years. I specialize in joint replacements, but I take care of all sorts of orthopedic issues. And I've created this channel years ago to give information to people that are searching for medically sound information about orthopedic issues, predominantly knee replacement, but a lot of other orthopedic and wellness conditions. So I wanted to use this discussion about Tylenol and its link to autism as sort of a sounding board to talk about something that's more relevant to my patients. But to start first is that when I look at scientific research as a physician scientist, I am looking at studies specifically to determine, are the authors unbiased? Because if an author is a paid consultant of a particular company and they come out with a conclusion, you always wonder if there was bias behind the study and the conclusion that they drew. The other important question I always look at is, did they have a specific hypothesis? Did they have 1, 2, 3 questions they were trying to answer? And did the methods and materials help answer those questions? And was it statistically significant? Meaning, was it powered to come up with a conclusion that you could draw as a true conclusion? Meaning that if we did a power analysis and say we needed 1,000 patients in 2 groups of 500 to determine a difference, if you only studied 10 patients, whatever result you got isn't real. You can't draw conclusions from that type of study. And the other important thing is when we look at the actual study and the results is, does the conclusion match the results? Sometimes authors soapbox. So in the media, they talk about the conclusions, but they didn't really look at the article and the conclusion didn't really match what the study actually studied. But when you look at studies from our standpoint, pretty much 2 sources that we look at nowadays. PubMed, which is a great online resource of all articles, most of them peer-reviewed journals. And more recently, a lot of people have turned to Google Scholar, which is a good accessible resource to find scientifically sound studies to help answer questions as opposed to just a web search. And what the vast majority of studies have found about the link between autism and the use of acetaminophen is that they haven't found a link. Now, when you look at studies, and you can look at study after study after study, you will find some studies that do, in their conclusions, find that there is a link between autism and the use of acetaminophen. I even found one study as I was researching this that actually found not the use of females with a baby in utero link, but actually a link between the use of acetaminophen in young children for, say, fevers or chills or flu and autism. So when you go searching, you have to understand that you can't draw a conclusion from one study. You have to look at all of studies and try to rank the studies into what is the best type of studies, and let's look at those, and you're going to find other studies that are not as good. So when big medical associations do these, they come out with guidelines for basically everything. In orthopedics, we have guidelines for every body part that you can imagine that hurts, and it's based on groups coming together and looking at the scientific-based research and coming up with a conclusion and a statement from that organization. And all of the organizations that are big major organizations have not found in their guidelines that there is a link between the use of acetaminophen and autism. So the American Medical Association, the American College of Obstetricians and Gynecologists, the National Medical Association, the American Academy of Pediatrics, all have guidelines that state that they have not found a link between the use of acetaminophen and autism. But like all medications and alcohol and processed food, everything should be used in moderation. So when I talk to my patients about any medication, the idea is the lowest effective dose, meaning that if 1 or 2 doses of a medication make you feel better, stop. When I hear about patients that are taking things like ibuprofen or Tylenol for months, that really raises a red flag, and they're putting themselves and their organs at risk. So you have to be cautious of any medication because anything that you put inside your body has a potential risk. And acetaminophen does have risks. The most frequently studied and reported risk is damage to the liver and liver disease and liver failure. So the FDA, even years ago, came out with information when the rates of liver failure were super, super high and linked to the use of acetaminophen, that the companies that make acetaminophen and sell it had to put labeling on the packaging about the risks of the medication. And even for a while, they lowered the daily recommended dose to 3,000 milligrams, where in most other countries, it's 4,000 milligrams per day. And why? Well, because a lot of people didn't realize that Tylenol or acetaminophen is in other stuff. So if you are taking cold and flu medication, there is Tylenol typically in most of that. If you're taking headache medication, there is Tylenol in most of that. If you were prescribed a narcotic like Norco or Percocet, there is acetaminophen in that. That second number, like the 325, is the amount of milligrams of acetaminophen. And many patients were and still are unaware of that. So you have to be very cautious, not only what you take from a prescription from a physician, but what you buy over the counter. And this is where I have always had a hard time with direct-to-consumer marketing. So any of us that watch TV will get bombarded with commercial after commercial after commercial about a prescription medication that you can only get from your doctor via prescription. And they're going to tell you all of the risks and benefits and side effects. Now, you can't go out and get that. Your doctor should be talking to you if you need that and go over the risks and benefits with you and then prescribe it. It should be a discussion between you and your physician. Yet, you see article or commercials about acetaminophen and Motrin and Advil and Aleve, all of these patients getting back to hiking and skiing and pickleball, and never once do you hear about the risks of liver disease with acetaminophen or kidney failure or ulcerations with Advil and Motrin and Aleve. And yet this can be advertised to us out the wazoo. The only countries currently that I know of that allow this are the United States and New Zealand. So this is something that I really would hope that would just go away. But you should hold the bar at the same level for over-the-counter medications as well as prescription medications. And the other big risk that we run into as far as patients that I take care of and see is that you can go in, not that I have anything against big box stores, but you can go into a big box store and buy like a huge bottle, like 500 or 1,000 pills of acetaminophen. So who knows how many of those you're taking in a regular day if you have this huge amount at your disposal. If you go to other countries and go to a pharmacy, usually you can buy a small box with a small number of pills. And usually it's the lower dose acetaminophen, like the 325. Because if you want the higher dose, like the extra strength 500 or the arthritis strength 650, you usually have to get that from a pharmacist who will ask you about what medications you're on and what medical conditions you have. It puts you in a safer position because somebody is watching out for you and making sure that you don't do something that could potentially harm you. The problem is that pain still exists, and acetaminophen as a medication to reduce pain and fever is still a very good drug. It's something that I recommend on a regular basis to my patients, and especially in those patients that either have kidney disease or have had stomach ulcers or are on a blood thinner. They should not be taking anti-inflammatories or NSAIDs. So that would be ibuprofen, which is Advil or Motrin, or naproxen, which is Aleve. Usually the safe over-the-counter medication for them is acetaminophen. But if I have a patient with liver disease, I'm also counseling them that they shouldn't be taking acetaminophen because they already have damage to their liver. Now, we use acetaminophen frequently for arthritis and joint pain, and it is a major frequent component of our multimodal pain regimen after surgery, such as hip replacements and knee replacements. So it is out there and it is being used, and it does have its benefits. But again, like everything, there are always risks. And you, as the person taking the medication, always need to be aware of what the risks are for you. And the best person to have that discussion with is your physician. So if you have questions about your medications, whether or not these are prescription medications or things that you buy over the counter, discuss them with your physician and find out whether or not they are safe for you. And if they are safe for you, what is an appropriate dose? How much of it should you take and for how long? So I really hope that you've found this information helpful. If you enjoy this content, give me a thumbs up. It really does help the channel. And if you haven't already subscribed, subscribe if you would like to find out when new videos like this come out in the future. And until next time, as always, I'm Adam Rosen. Thanks for watching. Stay safe.